Hey, it's Dr. Miller here, and Marissa.
Hello.
And I have another example to explain to you sort of the restrictions that I have, or all rhinoplasty surgeons have, in getting definition based on skin type. And we're always trying to come up with ideas to try to explain this, and I came up with this idea. So if you take a look at this, okay, now obviously it's a hand, right? And you can see that it looks like it's pretty well defined, okay? Now, just like the nose is pretty well defined if it is a defined nose, and it contains skin, subcutaneous tissue, but more importantly, bone and cartilage. And bone and cartilage gives a definition to the nose, but the skin itself has certain shape, like the shape of the glove. So if I take the glove off, right, it isn't as if the shape of the glove just becomes amorphous or it just changes to something else, right? It still looks like a glove. And, right, you saw how well defined it was on my finger, but if I take the same size glove and I now put it on a smaller hand, which would be the same thing as me taking the skin off and making the bone and cartilage smaller for a more defined tip. If the skin doesn't contract, then it doesn't matter how small I make the inside of the nose, we need the skin around it to contract. And while, yeah, I can pull it down like this and maybe trim off the excess, that's done in facelifts or upper lid blepharoplasty or browplasties. For my colleague, Dr. Steinbreck, he'll do that for breast reductions or tummy tucks. But you can't do that for the nose. So the only way that her nose can look as good as, or defined really, as mine, isn't if she just puts the skin back on, but if the skin contracts. And here is a more contracted skin because it's a medium. This is a medium. Mm-hmm. And now her hand looks as defined, if you will, as mine did, right? Even though it's smaller, but because the glove is smaller on her hand. That's the problem that we have when we're doing rhinoplasty all the time, is that I take off a certain, I sort of lift off a certain size skin, which has shape to it, right? It has a particular shape that looks like a nose. I modify what's underneath it. I take a big hand and I make it into a smaller hand, and then I put the same size, shape skin back on, and then hope that it turns into a more constricted, contracted skin to give the definition you want. I hope this is another example, or I'm always trying to come up with good ones to explain it to you. This is Dr. Miller.
And Marissa. Bye-bye.
We'll see you soon.